Good afternoon and welcome to today's webinar, What COVID Has Taught Us About Preparing Students for a Career in Healthcare. Today I'm pleased to be joined by one of our esteemed nursing authors, Anita Finkelman. Anita has been a longtime author for Jones and Bartlett Learning, and her works include Professional Nursing Concepts, Competencies for Quality Leadership, as well as Quality Improvement, a Guide for Integration in Nursing. Both of these textbooks have been widely used in nursing programs across the country. Anita has been a nurse educator for many years and has now moved into a consultancy role in both the United States and Israel, where she currently resides. Welcome, Anita. Please take it away.
Thank you. Okay, well, why don't we start with the first slide, and I want to welcome everybody who's here. As an introduction, we're going to look at some challenges. Now, I have to tell you, I was a little worried about this topic, mainly because I have no magic answers for you, okay? I think that the number of people who registered indicate to me that we're all very stressed. We've had a very challenging 2 years, a year and a half, and who knows, we may have more. And so we're trying to figure out where we are. And so this presentation is really to hit upon some issues that have come up. Some have been solved, some haven't been solved, and where we can go from there. It's going to take a group effort for sure. We know that we've been dealing with change and health and safety. All of a sudden, though, we've always been concerned about this with our students, has become even more important. And in addition, all of us, faculty, staff, within the academic institutions, in the healthcare system, our students have all been experiencing stress and burnout, and these are critical challenges for us all. I will say a little bit more about this because before the pandemic, these were critical issues that we were not actively addressing, but they were coming up and showing up. For example, the National Academy of Medicine, and I have this on the references at the end, in 2019 published a report about deep concern of stress and burnout in healthcare professions. And now, and soon after that, when the pandemic started, which only increased these problems. So mental health and student support services all of a sudden became even more important than they were in the past. We know that we've had issues with clinical experiences. We have issues trying to get more diverse students. And I will add that in the registrants for this workshop, there are not just nursing faculty. There are faculty in many other healthcare professions, which was very interesting and to me is very, very exciting. And in the next slide, you'll see that we have at-risk students, but also we have increased need for community-based experiences. We focused on acute care for a very long time. And now we've been confronted with public and community health issues and roles. And so that's another common theme in healthcare professions education now. And in addition, we all know we've had to adapt to a great deal of technology. I was telling Jen before we got on, I hope the technology works. And then I said, but if it can happen to Facebook, it can happen to us. So we all have that issue, and we'll talk a little bit more about e-learning. And then collaborating with our clinical partners and other healthcare providers, educators, becomes very important. We also have challenges preparing students to cope and provide care during the pandemic, okay? And I'm sure all of you have struggled with this a great deal. We have had to adapt quickly and effectively, and sometimes we haven't been able to do that. Student and faculty health and safety became very important. Academic administration is a very critical component during times of stress, all the time, but certainly during times of stress and crisis within the educational institution, because we must have support. Faculty, students, the non-professional staff, as well as the administrators, have to work together to come up with policies, procedures that protect our work possible. Student assessment is also a critical challenge, as we all know, and we've had to adjust both in clinical and in our didactic courses. How can we assess students if they're not in front of us? Most of us, and certainly for most of the healthcare. Providing the needed clinical experiences. We all know clinical experiences we have to provide, and we found we couldn't do it, and that was extremely stressful. And this led to some other issues which you'll mention shortly. Students had financial problems, faculty had financial problems, schools had financial problems. They might have had to drop out and come back in. And this all impacts academic progression. And of course, we're all interested in getting our students, regardless of which healthcare profession they're in, graduated and licensed and then in practice. In the next slide, you'll see we also had issues with student financial concerns. Students ran out of money. They had to work, or maybe they couldn't work because of the situation of lockdowns. And there was support for students and faculty becomes very important. We know about overload, a whole lot of overload. Sometimes we focus on faculty overload, but we know our students felt overload too. I put grief on this list because I think we've all confronted a tremendous amount of grief, personally, professionally, in our jobs or as students. And how do we cope with that grief? And how do we provide the support to our students? Grieving is a natural process, but is not an easy one. And we've all experienced this. Certainly, I've heard many interviews on the internet news of nurses who talk about their grief when so many patients are dying. And so that's something we have to address with our students now. Student-centered education has been talked about to do this and include the students, and I'll mention some other things later. Those are the challenges that we've had. We also have preparation of faculty, which is, of course, a critical element. When you're under crisis situation, having nice workshops to learn about methods of teaching or new approaches, there's no time for it. Or people can't concentrate. And so we have to prepare ahead of time for the future. We've learned now with the e-learning that we have much to learn and improve on, and we can learn from what we've done and move on and develop new teaching and learning strategies and improve what we do and be prepared if we need it. We know there's changing expectations, and with the e-learning, for example, I taught years and years, long before it was popular, and I can't tell you how many people would say to me, "Oh, that's an easy thing to do." Well, it's not, and I think many of you probably know that now. It takes a lot of time to do it well, and so that is a workload issue. And we all know that sometimes administrators may expect a certain workload and we may see it in a different way. Coping with technology and e-learning is absolutely critical now. And I will end with a few comments of a study that was done related to e-learning. Also, simulation and virtual simulation. Many of us had to learn on our feet because it requires training to do simulation. You can't just walk in and do it. And that was the expectation in many areas. So preparation of faculty. I've already mentioned stress and coping and engaging students. In the next slide, you'll see changing models of care also became important. We also had to change how we assessed students. I recently was reading something and it commented that the faculty person, which was not somebody in healthcare professional area, decided to go away from the multiple choice exams because there were all the security issues with the e-learning, and moved to discussions and essay questions. Now, you and I both know this takes a whole lot of time to evaluate these. But in the end, the faculty felt that she had a better assessment of the students, and they didn't have the stress of worrying about the e-learning, the internet not working, etc. And she got the assessment that she needed. So we have to look at what we're doing with assessment. The unknown and how long is something we don't know. How long will we have to continue this? Will something happen again where we might need these tools? And I think we have to be serious and accept that and figure out how we can make the best out of it. Another issue that has come up more and more, obviously, is faculty to faculty interaction when you're not in the same building. And how do we make that happen, even if it's virtually? The next slide, you'll see some strategies. Now, number one, I put up there is to take care of yourself. And if you don't do that, and if you're so stressed, you're not going to be helpful to others. And I think schools of nursing and other programs that have an intense type of student experience, the administrators have to look at how can they offer support to their faculty so that they're not worn out. In addition, we all know that during this time, we've all had incredible personal responsibilities. These are not something school administrators think about very often. But when you're teaching from home and you have young children or even teenagers, it's not easy. And how does that impact what you're doing? So administrators really have to look at that issue and that problem and try to come up with ways of supporting their faculty so that they have the energy to be creative and innovative and respond to student needs. I put down here, you see at the bottom of this slide, I have teams and team learning. I always tell my students that it's not group, it's teams, because in healthcare, we work in teams. And we need to incorporate much more of that into our educational experiences. And it can be done in e-learning. I've certainly done it. It can be done in a regular face-to-face classroom, but we need much, much more of this. And in the next slide, you'll see, I put on here, I'm just highlighting some of these things. The e-text, they've become very popular and they're very important. But students need to learn how to use them. There are all kinds of options that can be utilized with the e-text. Faculty need to know how to use them too, so that the students can have the resources they need. I was amazed many years ago when I asked students about a hard copy book. They didn't even realize or didn't pay any attention to the index and the appendices and look at the outline and see how it looks for the text, et cetera, et cetera. So we need to help students and guide them with e-text. Faculty sharing, like we're doing here. Ideally, if we could all talk together and have a cup of coffee or a cup of tea, it would be wonderful, okay? And we can learn from each other and to learn from different professions. And here hopefully we have in the group right now a mix, but certainly in the attendees, we have a mix of people who teach different subjects, but all in healthcare. And so we need to take the time to learn from each other. There are many different kinds of e-learning strategies now, online and hybrid methods, even methods where students get to choose if they want to be online or in the classroom. I know here in Israel, in the medical schools, in the nursing schools, we've started back, and a student has the option to be in classroom or to be online. And it was set up that way in case a student is in quarantine, they have a way of getting the class experience, okay? So in the future, this may be the model. We don't know that, regardless of pandemics. Research is very important. We've had, obviously, I would suspect a serious drop in research because it can't be the priority when you're trying to readjust curriculums and teaching methods, et cetera. But we need to learn about what we've done, and we need some research on how this works and what the outcomes are. In the next slide, coping with personal reactions. As I've already said, that staff are seriously dealing with this now. But as students go through their education programs, regardless of what that program is, we need to address personal reactions and what we can do about it, how we can help each other, how can we support each other. In addition, we've hopefully dealt with, not well. All of a sudden, patients are in the hospital, very, very sick, without family. This has added an additional burden, certainly on staff, in addition to the emotional burden on staff. It wasn't something we expected. So I think this is something we need to start to address in our healthcare profession education programs, to talk with students, figure out ways of approaching so that patients can feel a connection to the staff and some methods for connecting with families. Leadership is always part of our curriculum and continues to be. And in the United States, there is now more of an emphasis on health equity and justice. And so those are all things that now we have to consider very carefully in our programs. And we all know about infectious disease and the implications that had. I mean, our students were not prepared in any healthcare area for using PPE, the protective equipment. Many schools even had trouble paying for it if they couldn't get it from the clinical site. So these are all things we have to prepare for if we should ever need a response again as far as infectious disease is concerned. Now, I want to make a few comments. The first element there on the slide, the core competencies. These are the professional core competencies that were developed some years ago by the Institute of Medicine, which is now the National Academy of Medicine. They decided they would identify 5 core competencies for all healthcare professionals. I think they're very important. And the critical thing about this is they decided to make it a group effort in the sense of everybody is included in this. So nurses, doctors, respiratory therapists, lab workers, physical therapy, radiology, etc. These are the core competencies that we need to look at in our curriculum, regardless of pandemic, etc. Collaborative learning also has become, even before the pandemic, certainly very important. I think it's even more important now because we need to work with each other post-pandemic and figure out how we can be more effective and efficient. The community crisis response obviously is very important. I'd like to cite a particular example, and that is the crisis standards of care in the United States right now. I'm sure some of you know about those. That's not included in any program I know of. This is a very important thing. It has to do with ethics, legal issues, and it's a decision about rationing care. And there are specific standards for this. And some of the hospitals in the United States have implemented these standards. So what do our students know about these? And what should they know when they go into practice? And so this is very, very important. I've already mentioned leadership and quality improvement. Changing models of care, we know it's been going on for some time. We know that during the pandemic, we've had to adjust how we provide care, how many people are working on certain things with patients, and what works and what doesn't work. We need to know what those were because we have to prepare the students for when they go into practice. Staffing, well, that could be, we could stay here all night talking about staffing, but students obviously need to know about workforce issues and staffing, and how is the best way of resolving those problems. For example, during the pandemic in the United States, we have very strict rules about nurses and doctors and other healthcare providers are licensed by a state. If you go to work in another state, you have to get a license from them. This became problematic when one state was short on staff and asked another state, can you send me some people, volunteers who will come for me? Well, they were licensed in that state. The regulators stepped in and were flexible. But this is an example of an innovation that happened during a critical time. I can tell you that would have never happened pre-pandemic. Those are very strict rules and very rigid. But now we have an opportunity to look at that issue. And so related because we have staffing issues that come up to pandemic at all. We also need to tune in to certainly speak public policy and communication in our countries. We need to speak up about it as healthcare providers, and our students need to know about them. We've also had a severe disruption in staff education, and I was director of staff education in 2 acute care hospitals many years ago. And I can tell you, I wasn't there during a pandemic, but when there's a crisis, number one off the list is staff education. There's no time for it. There's no money for it. There's no energy for it. So now we have an issue of a lot of staff in hospitals who are behind in getting updated, et cetera, et cetera. And that has an impact for our students because our students work with the staff in the hospital. Practice academic partnerships, I'll make one comment about, and the National League for Nursing in the United States worked together to try to figure out this issue of getting clinical experience, and a trial was done in which students were actually hired by hospitals and they were classified as essential workers, so they could be. There's a description of this whole process so that they could get clinical experience when they couldn't go in there as a student. I recommend some of you look at that if you're interested in that model. Many states tried it out, and I believe it's listed on the references. Curriculum issues, oh boy. Well, we all know this is a toughie, okay? That we have many things that we have to put on the addition in the curriculum, and we all know the old saying is we can't add any more to the curriculum. What we have to sit down and really look at our curricula. What's absolutely essential? Look at competencies that we need, and then figure out what needs to remain and what can be moved, and that. This is something we need to be able to do quickly all the time, not just during a time of pandemic. This is an ideal time now, as hopefully we go into post-pandemic at our curriculums. These are some examples, and believe me, I tried to be very careful, okay, because I don't want to overwhelm you, of new content, or at least content that needs to be expanded. Disparities, health, justice, and equity, population health, epidemics, pandemics, and I would add on epidemiology. Global health, very important now, we know. Health policy, community public health. We have emphasized acute care ad nauseum, and we now know we can't do that. We have to pay more attention to public and community health. And our students, regardless of what they're studying and what they intend to be in their life and their career, need to be tied into community and public health. There are long haul issues now with COVID. We have no idea what that's going to mean, but it's certainly going to impact our curriculum. Okay. Social determinants of care. And certainly in the United States, we have an increase in violence, in substance use, the need for mental health in all countries, ethics, and the impact of isolation on all age groups. There are also needs related to delivery, access of care, rural health, home health care, patient flow. And we've seen that with some of the hospitals, when patients are sitting in the driveway instead of being in the hospital, and how do we handle these things? primary care, occupational health has all of a sudden become important again because of all the restrictions and the health issues and safety issues related to an infectious disease. Interprofessional teams, pandemics. But we have to remember, disasters are experienced all the time. And many of the things that we could talk about in responding to education needs for a pandemic apply to disasters, floods, earthquakes, etc. Now, with your technology, and I wanted to say a couple of words here, and then I want to refer you to, in the references, you will see there's a study that was done by the NLN. It's the second survey of IT that has been done. This one during the pandemic, but prior to that. And just to give you just a few percentages here, 73% of the, this was nursing only, this particular study, went fully online during the pandemic. And 40% said they planned on continuing to offer online courses, okay? And that's the question we keep wondering, I keep being asked, certainly. How long is this gonna go on? Right? Is this something we're gonna do forever, or the e-learning? And what can we do with this information that we're learning? So that's a very important aspect. And the study identifies in very clear terms that many places are considering continuing with some elements of e-learning, okay? These are some thoughts to consider, and I think you can read them, but I'd like to summarize because these are some important times. We all need to take the time to assess the status, our status. And this will take some time. What did you do successfully? What did you not do successfully? And what do you want to continue? We need to get feedback from everybody. Faculty, administrators, don't forget the staff. They have a lot of information. Our clinical partners, our administrators, and our students, both the students we have now, the students we had in the past, and the students who went through this experience and graduated, get their feedback. We need to pay attention to standards. They're changing. In nursing, we have some major changes in standards. The AACN just changed their standards, and NLN is changing their standards. This is all going to impact all this at the same time. Other healthcare professional organizations have their accreditation standards. They're important. We need to look at budget for technology, budget for staff, budget for emergency situations, etc. Very, very important. Our curriculum, I've already pointed out. Interprofessional issues. This is an ideal time to turn in your community to other healthcare professional educators at your university, at your college, at another university or college. What can we do together? Because there are things we can do together. There is some core content that's similar, and we need to look at it and try to save ourselves some time and energy. And who knows, we might learn something that's really important, some new innovative idea. Very, very important. If we're teaching our students they have to practice in interprofessional teams, then we need to do it in education too. I feel, and that's why I was so excited to see non-nurses in this group. All of this applies to everybody. I haven't said anything really that only applies to nursing. Increasing our methods to provide support for students and faculty and staff. Our services that we provide, what worked, what didn't work. A lot of this comes from our colleges and universities, so we need to sit down with the staff and who handle that and figure it out. And then faculty sharing. How can we share more and work together more, whether it's in our own professional area or interprofessional, and then we can go faster that way, and we can be much more effective. Okay, the next couple of slides I'm not going to look at in detail because you can go back. This one here are some examples of resources that can help faculty. There are professional organizations. I put just a few of them, and there are many of them. The clinical specialty organization, there are standards, accreditation. The government has tons and tons and tons and tons and tons of information, and it's free. It's even free if you're not in the United States. So you can go in and find all sorts of information that can help you with your teaching. And many of the information sources there, students may be using Knoxville after they graduate, so they need to know about them. And then, of course, we have our global institutions that have much information to offer. The next couple of slides are what are some resources, references, okay? I didn't use all these references, but I wanted to give you some examples. I tried to put the links there and some titles so you could get it. The National Academy of Medicine publishes many, many reports. They're available for free. They used to not be. And you don't have to be in the United States. And you can download their reports. They're excellent reports in all kinds of subjects related to patient care, quality care, education, etc. And you'll see the other comments there. There is a report on the first there from the National Academy of Medicine on the lessons we've learned in healthcare profession education during the pandemic. That's an example, okay? And you can go to the online site and you can see the report. There's a lot on population health and some of the other sources there. Faculty Focus, that is not a healthcare site. It is an education, university education site, has excellent articles, resources, webinars, etc. To help you develop your teaching, learning strategies, curriculum, etc. I get an email weekly from them with information, and you can set that up and get it, and you can look at what you want to look at or not look at. And the people who are writing for them and publishing for them are from all over education, and you can learn a lot. It doesn't have to be healthcare professional education. Let's see, there's up at the top, you see there's the report I mentioned about clinician burnout, and that's from National Academy of Medicine. And they actually, there's a website and all kinds of tools and things that can be used. And then, of course, at the bottom you see, and there are all sorts of COVID resources, of course. Some of them could be applied later for other things. And so, and then the last slide, I think, is lots of resources on e-learning and on learning. And digital health. That's another subject for our students. Okay, that's it for me. Jen?
Well, that concludes today's webinar. I want to thank everyone for joining us, and I want to extend much appreciation to Anita Finkelman for hosting today's presentation and for all of the outstanding tips and strategies she offered, as well as all of the resources and research that she lent to today's presentation. And if you're not connected with us on social, I do encourage you to find us on LinkedIn, Facebook, Twitter, as well as YouTube, where you can find out more about teaching tips from fellow faculty and authors, a little bit more about some higher education trends. You can read our latest blog posts, and you can also find out about upcoming webinars and conferences that we're attending. Thank you so much.